the other systems so that they work harmoniously and efficiently. The brain and the nervous system form an intricate network of electrical signals that are responsible for coordinating muscles, the senses, speech, memories, thoughts, and emotion. The nervous system is divided into two main parts, the central nervous system and the peripheral nervous system. The central nervous system consists of the brain and the spinal cord and is responsible for sending out nerve impulses and examining sensory data. The peripheral nervous system is made up of the specialized cells called sensory neurons and motor neurons. Sensory neurons receive information from the environment and bring it back to the spinal cord and brain. They sense such things as temperature, pressure, and pain. Motor neurons send information from the central nervous system to the muscles, glands, or other structures, causing them to move or act. We can also divide the nervous system into two functional groups, the somatic nervous system and the autonomic nervous system. The somatic nervous system is part of the nervous system that we have voluntary control of. This system is made up of two kinds of nerves, cranial nerves that originate in the brain stem and are responsible for smell, vision, taste, etc., and the spinal nerves that originate in the nerve roots of the spinal cord and go to each muscle fiber. The autonomic nervous system, think of automatic nervous system, is responsible for running your organs and viscera. For the most part, autonomic nerves are not under conscious control. For instance, no one has to try to digest their food or remember to keep their heart beating. Although we do have some control, you can slow your breathing if you try with some yoga practice or meditation, and you can also learn to slow your heart rate and other body functions. So, although it's largely automatic, we do have some control. And this control stems from the fact that this part of your nervous system has two sets of nerves that perform opposite functions. One grouping is called the sympathetic division and the other is called the parasympathetic division. The sympathetic branch exits the thoracic vertebrae. These sympathetic nerves innervate each organ and when activated increase the heart rate, speed breathing, secrete adrenaline, and decrease digestion, all the signs of being nervous and angry. This is the fight or flight response. On a subtler level, perhaps you've experienced how food sits in your stomach when you're stressed. This is because the stomach is not very active if the sympathetic nervous system is on. Excessive sympathetic output is what causes many stress-related conditions such as headaches, high blood pressure, and anxiety. To balance the sympathetic division are the parasympathetic fibers. When the parasympathetic fibers become active, the heart rate decreases, the breath rate decreases, and the digestion and peristalsis increase. This is the rest and rejuvenation nervous system, and massage increases its activity. Amazingly, the parasympathetic nervous system exits the sacrum and the cranium and travels from these exits to the same organs that the sympathetic nervous system reaches. As you can see, the sympathetic and the parasympathetic systems work in conjunction with each other to balance the body's needs. This internal balance is called homeostasis. We need the sympathetic activation to become filled with energy, sharp and focused. But too much sympathetic activity makes us stressed. Long-term sympathetic activation depletes the body. Massage powerfully activates the parasympathetic nervous system and helps to bring balance, rest, and rejuvenation. Now let's discuss nervous system conditions. Multiple sclerosis is a chronic degenerative disease in which communication between the brain and other parts of the body is disrupted due to the gradual destruction of the myelin sheaths. Symptoms include weakness, loss of muscle coordination, bladder dysfunction, and blurred vision. Massage is highly recommended in the subacute stages to maintain flexibility, alleviate muscle spasms, improve immune system function, and provide a much-needed sense of well-being. However, in acute stages, the therapist must be careful not to overstimulate the client, which can cause painful muscle spasms. Parkinson's disease is a progressive disease associated with the destruction of brain cells that produce dopamine, a neurotransmitter that helps the brain to regulate movement and emotion. Symptoms range from depression to limb rigidity, fatigue, and a resting tremor. Although massage does not inhibit the progress of this condition, the benefits have long been appreciated by Parkinson's patients, particularly in relieving joint and muscle stiffness. Special care is needed when treating this condition and should always be under a doctor's supervision. Peripheral neuropathy is not a disease, but a combination of conditions that result in damage to the sensory and motor neurons due to a variety of causes such as diabetes, alcoholism, AIDS, nutritional imbalances, or common environmental hazards. For sensory neuropathies, the symptoms include tingling, burning sensations, shooting and aching pain, and extreme sensitivity to touch. Motor neuropathy symptoms include weakness in the hands, feet, wrists, and ankles. Massage, for the most part, is locally contraindicated depending on the underlying causes of the neuropathy. However, with the doctor's clearance and depending on the client's level of discomfort, gentle massage has been known to help improve circulation, stimulate nerves, and temporarily relieve pain. Strokes are a sudden loss of brain function caused by a blockage or rupture of a blood vessel in the brain. Strokes are characterized by weakness, dizziness, loss of muscle control, loss of sensation or loss of consciousness, and often speech difficulties. Some symptoms may be paralysis, numbness on one side, impaired vision, and severe headache. Massage is only indicated in the recovery stage of a stroke, and then only with the doctor's supervision or approval because strokes are so often associated with cardiovascular disease. Headaches are defined as pain located in the head and are one of the most common nervous system disorders. In fact, they're the most common ailment that we experience in general. Headaches appear in different areas of the head, such as over the eyes, at the temples, or at the base of the skull, and the pain level can be anywhere from mild to excruciating. Most headaches start in the muscles of the neck and the head and are called tension headaches or muscular contraction headaches. Migraines, cluster headaches, and sinus headaches are classified as vascular and are also called congestive headaches because they have to do with the flow of blood in the brain. The most severe form of headaches are those that arise from underlying pathologies such as tumors, aneurysms, or other type of infection. If a headache is accompanied by high fever, slurred speech, numbness, motor control problems, or lasts for more than 5 days, then massage is definitely out of the question and the client should see their doctor. Massage is very helpful for those suffering from vascular or tension headaches. Massage techniques. All massage techniques affect the nervous system in some way. One modality that specifically affects the central nervous system is craniosacral therapy. This type of bodywork has the intention of balancing the membranes in the brain by directly working on the cranium. General massage techniques affect the nervous system by stimulating the receptors in the skin. To specifically activate the parasympathetic nervous system and bring your client into a deep state of relaxation, perform strokes that are rhythmic and slow. One example of this is effleurage to the back. Another technique that specifically affects the parasympathetic system is called the dolphin touch. Use a light touch to gently glide down the back, hand over hand. Another parasympathetic activating stroke is the hold. Done with presence, this strongly activates the rest and rejuvenation properties of the parasympathetic nervous system.